So I'm just going to check your blood pressure, okay?
Staff at this Ontario hospital have been working to reduce reliance on private agencies that provide temporary hires like nurses to help fill shifts. Agency use here soared when the COVID-19 pandemic hit as demand increased and nurses left the profession.
The challenge in working with agency nursing is primarily that there's a much higher cost.
A new report shows Ontario hospitals paid for-profit agencies $9.2 billion over 10 years. Per capita spending on agencies nearly doubled between 2013 and 2023, while for employed staff it increased by only 6%.
This is a very expensive form of staffing hospitals, but it's coming really at the expense of being able to invest and make those investments in the long-term workforce.
This recently graduated registered nurse says her staff job at the hospital is more appealing than agency work.
Working in the agency, you do have a flexibility and probably you will get more pay, but in terms of support and the teamwork, I think personally that's something very important for me.
The Canadian Federation of Nurses Unions has called the use of agencies band-aids on gaping wounds.
Quebec recently passed a law limiting the use of private staffing agencies in some parts of the province, with a plan to phase them out more widely by the end of next year.
Nursing agencies.
But critics say that doesn't solve underlying problems like working conditions.
We have to deal with the root issue, the root cause of nurses leaving, rather than just putting stop signs everywhere.
Everyone is well staffed.
A spokesperson for Ontario's health minister said agency staff hours represent less than 2% of the total hours worked in hospitals. The report's author calls on Ontario to boost hospital funding and follow Quebec's lead to phase out agencies over the next 3 years. Alison Northcott, CBC News, Montreal.